medicines are quietly losing their effectiveness. In many Indian households, the moment someone falls sick, the first stop is not a doctor, it's the pharmacy.
Don't move to a chemist and buy an antibiotic over the counter. It's a myth that the antimicrobial resistance is confined to hospital settings.
Antibiotics are taken without proper prescription.
Antimicrobial resistance is much bigger and a complex problem than your COVID.
This is a conversation about keeping our loved ones safe and healthy. I'm Faye. Let's begin with something almost every family in India has experienced. A fever appears. We take the same antibiotic that worked last time. And this time, it barely makes a difference. And yet, we readily pause and ask why. Over the years, we've slowly normalized something very unusual. Medicines that are quietly losing their effectiveness. But antibiotics haven't changed. The germs have. They've adapted, they've grown sharper, they've learned how to survive the very medicines that were meant to kill them. And honestly, a big part of this story begins inside our homes. In many Indian households, the moment someone falls sick, the first stop is not a doctor, it's the pharmacy. Some of us ask for the same medicine that helped last year. Some of us use leftover medicine strips that are lying in the drawer. Some even stop the medication halfway the moment the fever drops. It seems harmless, but it sets the stage for the biggest health challenge of our generation. Because every time antibiotics are taken without proper prescription, or are stopped too early, or are used for illness like viral fevers or bacteria, the bacteria gets one more opportunity to adapt. They learn, they evolve, and they become more difficult to overpower. This is antimicrobial resistance, or AMR. And this isn't a textbook medical concept. It's already here. It's affecting our homes, our schools, hospitals, even the food and the water around us. Now, to understand how serious this has become, let's take a look at what the data is telling us, but in a way that actually fits into real life. A recent India-specific study published in The Lancet found that 83% of hospitalized patients carried at least one multi-drug resistant organism. Think about it. What that really means, you walk into a hospital and you're already burdened with AMR that doesn't respond to common antibiotics. Isn't that scary? And it doesn't end there. According to the National Antimicrobial Resistance Surveillance, some of the most common infection-causing bacteria in India, like E. coli or Klebsiella pneumoniae, are now resistant to 70 to 80% of the antibiotics routinely used. This isn't a problem for the future. This is something that's happening today. In ICUs where routine infections require stronger medication, in OPDs where the standard treatment has stopped working, and inside our homes where medication shortcuts are becoming a habit. So here's the part that families often miss. AMR, or antimicrobial resistance, is not confined to hospitals anymore. It has moved into the water that's flowing through our cities. It has in the surfaces that we touch all day, the same everyday environments where our children study and play and eat. Resistant bacteria is quietly becoming part of our daily life, far closer than most of us realize. Why is resistance rising? How everyday behaviors quietly accelerated? What India is doing at a national level, and most importantly, what simple habits can families adopt at home to reduce the need for antibiotics altogether? Savlon Swasth India Mission and I, in this collaboration, bring you this series on antimicrobial resistance awareness, a movement focused on strengthening India's hygiene practices so that infections are reduced, antibiotics remain away from us, and not our everyday fallback. Joining us today is Dr. Vijay Yewale. He's the consultant pediatrician at Apollo Hospitals, an infectious disease specialist, and someone who sees the reality of AMR every single day. Savlon Swasth India Mission wants to emphasize that healthy habits go a long way in preventing antimicrobial resistance. Doctor, I want to open this segment talking to families directly. We never really ask why are everyday infections suddenly becoming serious illnesses. In fact, the illness isn't new. The bacteria is new because it's changing on a daily basis. And a lot of times mothers will say, my children are getting sick more often. Teachers are saying that one child gets a cough, now everybody's got that cough. So are we becoming weaker? Are the germs becoming stronger? What is actually going on?
First of all, thank you so much for bringing in this very, very important issue. And I will not be making an overstatement if I say that today, antimicrobial resistance is much bigger and a complex problem than your COVID. The COVID pandemic shook us up, but AMR is much more strong, magnanimous. The magnitude-wise, it is much bigger and much complex. And I cannot agree more on what you said, that the routine infections, which were easily amenable to treatment in the past, are becoming difficult to treat. So you ask me whether the bacteria have changed. No, bacteria are the same bacteria. Are the human beings changed? No. Then what has changed? The arsenals or the weapons, antibiotics which we use to tackle bacteria, they have become ineffective. Why has that happened? Because we are into a battle with bacteria who have been on earth much before we came into existence. It's a battle of survival. And the moment we use antibiotics indiscriminately, injudiciously, or irrationally, they learn to overcome the effect of antimicrobials. And that's the one reason why the same antibiotic does not work next time when you use it on the same patient for the same condition. And as you said, we are responsible. Leftover antibiotics purchased over the counter, incomplete course of antibiotic as prescribed by the doctors are a few examples. And as you said, it is in our hands. We can really do a lot by keeping the environment that we live in very clean. Hand washing, using sanitizers, and preventing infections would go a long way in preventing infections and indirectly preventing or curtailing use of antibiotics and curtailing evolution of antimicrobial resistance.
When we talk about, germs that are resistant right now to antibiotics, it sounds like something very serious that happens in a hospital. But actually, these are right now on all of our surfaces, right? Whatever our children are touching, all of the public spaces, you take a train, you take a bus, you take a taxi, you're touching all of these spaces, then you touch your mouth or your face and it's everywhere. How common is this right now, especially in India, in our cities? And what do we do to keep our children safe?
Absolutely right. It's a myth that the antimicrobial resistance is confined to hospital settings. No, today you go to the community, you have microbes or bacteria which are resistant to antibiotics flowing in the water, residing on surfaces. And once upon a time, simple cuts and wounds were easily treatable with antibiotics. Sir Alexander Fleming invented antibiotic and we thought we have won over the bacteria. But thanks to our use, abuse and overuse of antibiotics, as I said, it's the survival of the fittest. They learn to overcome the antibacterial or antibiotic and they learn to make antibiotics ineffective. Add to that, this inappropriate use has led to emergence of lot many resistant bacteria, which were confined to the hospital setting where a lot of antibiotics were used. Now they have jumped to the community. Today we see a lot of infections. Just to give an example, many of these common urinary tract infections that we see in hospital today, the germs come from community. In a child or in an individual who is otherwise healthy is infected with a bacterium which is antibiotic resistant. Where does it come from? It comes from the community. And as you put it very correctly, it is in the water, it is there on the surfaces. So a lot is to be done and can be done as a common man by preventing infection and by observing hygiene and good nutrition and good practices.
If I may just take that piece by piece, right? So you did talk about cuts and scrapes. And we were always taught from the time we were young that if you have a cut or a scrape, you clean it with clean water, you use an antiseptic, and if necessary, you bandage. Are you saying the antiseptic is not enough anymore? Then what do we do?
So unfortunately, antiseptics fortunately continue to work. But what we have changed, the practices have changed. One is we ignore. Secondly, instead of using antiseptic, it's not an uncommon practice to use an antibiotic, a topical antibiotic, say a cream or an ointment, which is not really required. Even today, in this era of antimicrobial resistance, prevention of infection is as important as treating infection. And that can easily achieve by keeping your wounds clean, using antiseptic, and then covering the wound and remaining healthy. What is done today? The moment you have a cut, you go across to a chemist shop, buy a topical antibiotic cream and apply it. The bacteria, which are not always harmful, they are exposed to this antibiotic, they learn to overcome their effect and they develop resistance. And let me tell you, unlike human creatures, bacteria are very friendly. The moment a bacterium learns to, make an antibiotic ineffective, this technical know-how or the genetic information is easily passed on to the other bacterium, regardless of the caste creed, unlike human beings. And that is how it spreads. So I keep saying, this is in our hands. You follow hygiene, wash hands, use antiseptic, and even today you can prevent infections.
How does an antibiotic work? And why is it that half treatment is more dangerous than no treatment?
So you have bacteria which are, let me tell you a quote from a TED talk. We have a lot of bacteria on our body surface and inside us. And if you go to count them, we are more bacterial than human. And these bacteria are trying to survive. And we are here trying to throw them out. Now, these bacteria at an opportune time cause disease. The good bacteria turn into bad bacteria or we contract bad bacteria. And when we consume antibiotic, the ones which are susceptible, vulnerable, they get killed. The tougher ones survive. And they are passed on into the environment. Next time, or the neighboring patient or someone else in the community contracts this bad bacteria which is resistant, and he or she gets infection with the resistant bacteria. So first place, don't use antibiotic unnecessarily so that the good bacteria are killed. Now, if you have, a huge number of enemies who have declared war on you, and you go with simple rifles, you will be, killed and they will win over. So you need to have adequate arsenal and weapon. I need to continue to battle until the enemy is wiped away. So by consuming half the antibiotic or antibiotic in inadequate doses, you tend to, you give a chance for the tougher ones to survive. And they come back with vengeance and they attack you more fiercely and they have resistant bacteria. So this simile, I think I've tried to explain to you that why it is important to use the right antibiotic at the right time in the prescribed dose and duration.
So just to recap that, you're saying that if there's a cut, then you have to wash, use antiseptic and cover it. But an antibiotic should only be used under the supervision of a medical practitioner.
Absolutely.
The other thing you talked about UTI, and you said it's become and be, I also, initially we were talking about E. coli, one of the main causes I understand of UTI. How do children how does that bacteria travel through our community and how does it infect someone?
So one is, how does one get an UTI?
Yes.
It is a poor hygiene around the genitals, perineal hygiene. That is one. Secondly, our practices have changed over a period of time. A lot of babies, for example, diapers which are not changed for hours. So somehow the bacteria gain an access and then they are treated with antibiotics. Very often the moment a patient starts feeling better, the antibiotic course is discontinued. If you half treat an infection, the antibiotics become, the microbes or bacteria become resistant. And next time the same antibiotic wouldn't work. Now, this antibiotic not only harms the patient, it leads to proliferation of antibiotics or bacteria which are not killed. So resistant bacteria grow and they spread from one individual to other through the community, through the surfaces, through the water. And the problem is compounded by poor hygiene and inadequate, hand hygiene. And that is what leads to spread of this bacteria, which very often are resistant bacteria.
There is medication, there is a role that the medical fraternity will play, but there is a role that we play at home as well. Keeping our surfaces clean, maintaining, actually, we never talk about maintaining cleanliness in our public spaces also, which is also our responsibility as a community. If you were to list the things that we can do as ordinary citizens to battle this problem, what would that be?
So, it's said charity begins at home. Let's clean our home first.
Yes.
Good habits need to be inculcated right in childhood. Washing hands after visiting a loo, washing hands after coming back from play, washing hands after coming back from school. Wiping right from the toys that a toddler plays to the desk that a grown-up child uses to write or study. And then taking care of the scraps and the wounds, little wounds and abrasions, which are not uncommon in a school-going child, is extremely important. The child needs to be trained and taught. So, and once you inculcate these good habits, it has a big role in preventing infection. Don't go to a chemist and buy an antibiotic over the counter. Antibiotics usually come with a red strip, or the bottle has a red label. So they are to be sold only under the valid medical prescription. There is a law. Unfortunately, enforcement is difficult. So unfortunately, even today, antibiotics are available over the counter. They are consumed, and the child starts feeling better, they are discontinued. Next time a child has similar complaint, parents tend to use from the leftover antibiotics, which is again incorrect. So avoid self-medication. Don't use an antibiotic unless prescribed by your doctor, and use it in the course that the doctor has prescribed you. Like say you are wearing a black jacket, I am wearing a black jacket, but there is a sea of difference between the two jackets. So the fever which appeared previous time was cured by a antibiotic may not be same as the fever that you are suffering today. So you need to consult a medical practitioner before jumping to using an antibiotic. And mind you, antibiotic is never an emergency unless a few conditions where doctors can make it. There, of course, you have to rush to a doctor and then take his advice.
There is a difference when we have a fever at home, a difference between what a virus is causing and what a bacteria is causing. Tell us what the difference between these two things are and why antibiotics doesn't work in both cases.
So extremely important point you have raised. Fortunately, most of the infections or fever that we see in community are viral in origin. And antibiotics have a precise role in curtailing bacterial infections. They don't act on viruses. Now, antimicrobial encompasses antivirals, antibiotics, antifungals. But by and large, these infections are viruses, caused by viruses, and what we use are antibiotics. And antibiotics don't act on viruses. So what happens? I have a flu-like illness. It is a viral infection. I take an antibiotic, that too in inadequate dose for inadequate duration. I expose the good bacteria that I have inside me to antibiotics. They are killed and the toughest among them survive. Next time, when I genuinely need an antibiotic for a bacterial infection, this antibiotic would not work. So using an antibiotic for viral infection not only does harm the child or the patient, but it harms the community as well. That's the basic difference between an antibiotic and other medications.
As a doctor, how do you tell the difference between a viral fever and a bacteria-linked?
Viral fevers, they start all of a sudden. The degree of fever is usually high. There is a reasonable response to anti-fever medicine like paracetamol. And the child continues to remain active once the fever is down, doesn't look very sick. On the other hand, a bacterial infection, the fever is not so high to begin with by and large. It worsens with every passing day and the child would appear sick.
And not respond to paracetamol?
Absolutely. He may not respond fully to paracetamol. And as I said, it's never an emergency. There is always time on hand. And at home, in an emergency, you can use paracetamol to control fever, but not an antibiotic.
Savlon Swasth India Mission wants people to first understand antimicrobial resistance and the need to act towards it. We often imagine antibiotic resistance as something that is an after effect of complicated treatments, critical infections, or hospital misuse. But India's environment studies show a very different picture. Urban wastewater samples from North Indian cities have shown the presence of antibiotic resistant genes in the water already, which means resistant bacteria aren't waiting inside hospitals. They're already circulating through the same water our cities rely on. And when you combine contaminated water with high-touch surfaces and environments in kitchens, school desks, railings, playground equipment, a single pattern becomes almost impossible to ignore. Clean hands protect more than anything else. So, doctor, is it fair to say that if we keep hygiene absolutely paramount, it could become India's very important tool in fighting antimicrobial resistance?
Absolutely, why not? In fact, infection prevention and control is one of the very strong pillars to combat antimicrobial resistance. And how does one achieve it? By consuming clean water, boil cool water or filter water. Secondly, keeping all these surfaces clean so that the risk of contracting infection goes down, and then you don't spread infection from one individual to the others. So it's extremely important, not only from our country perspective, but globally. Hand hygiene, clean hands and clean water are very strong, low-hanging fruits which one can really catch and, combat antimicrobial resistance.
There's also a need, would you say, and this is what, my child's pediatrician has told me, allow the child to build immunity by beating this fever on his own. How important, what does that mean and how important is it?
Agree more on what your pediatrician has said. Ultimately, what is fever? Fever is sign of our immunity. We boil water, we boil food to eliminate germs, disease-causing germs. Similarly, there is a mechanism in our body where the thermostat is set high and the body resists temperature so that the infecting viruses or bacteria are taken care of. So they are eliminated. So fever is a friend and not a foe. Allow the body's immune system to act. Let there be fever. If a fever makes a child uncomfortable, use paracetamol. Try and keep the fever under control. It will definitely reduce the child's discomfort. Don't jump to using an antibiotic. Allow the body's immunity to react. So I totally agree with what your pediatrician has said.
I remember reading one example, one sort of explanation of a fever a long time ago. It said basically your body is being attacked by a virus, and so the army of your body is now fighting. And so the fever is your body's way of saying, hey, I'm already fighting on one battleground, so can you rest so that we use all the energy for the fight and you don't do anything else. So your fever is your body's way of saying, I need you to relax today. And let's send all of our troops to this battle so that we can beat it.
Absolutely.
Is that accurate?
That analogy is absolutely fine.
So basically, if our children have a fever, give them an opportunity to win that battle on their own. Because every battle that is won will increase their immunity for the next time around.
And a fever where child's immune system by itself cannot handle the battle, there are enough number of telltale signs which would make a parent take the child to a doctor.
Yes.
And then let the medical practitioner decide what is best in the interest of the child.
So when there's a viral fever, which cannot be treated with antibiotics, and the child is not able to overcome that fever, then what route do you take as a...
Let me correct you first. Viral fever which should not be treated with antibiotic. And so allow the body to, 48 hours at least.
Yes.
Watch for some signs where, as I said, if the child starts looking sick, does not accept food, is still not lying, is out of its routine activity, consult a doctor. Yes. Don't go across to a chemist and buy an antibiotic. Yes. Let the doctor decide.
There's also, we now live in a country where most of our big cities have very strong air pollution. This is weakening the respiratory systems of our children. They're making them more susceptible to constantly coughing, runny noses, burning eyes. So as parents now, it's becoming more and more difficult to be able to tell the difference. Is it an allergic reaction to the dust? Is it viral? Is it bacterial? So what do we do?
So over a period of time, especially in cities, you have overcrowding. The air quality, thanks to our practices again, is deteriorating with every passing year. There's a lot of pollution, lot of air pollution. The air quality is no longer the same as it was before. And there is an increase in respiratory issues, a flu-like illness, common cold, cough, wheezing. And all these have definitely increased in numbers. But again, as I said, we understand there is a risk factor. Many times these are allergic reactions or responses of the body to these offenders. and not necessarily a bacterial infection. The number of times that a child tends to fall sick because of this pollution and overcrowding, every time a child falls sick, the number has increased, and every time antibiotic use has gone up. That's not the case. You need to consult a doctor and understand if the problem is because of air pollution, if it is allergic, if it is a viral illness. It is the viruses which make multiple rounds when there is increase in air pollution. And these respiratory ailments more often are viral than bacterial.
In a lot of our families, we have pets. There are families, and I understand, who other than dogs and cats also have rabbits, some have birds. And children tend to be very affectionate with animals, which I understand is a good thing. But research tells us that veterinary infectious diseases also pop up. Other than E. coli, there are other things that the pet is carrying. They will lick the child, or they will come in with dirty paws onto the furniture. There's a lot of exchange of bacteria between child and pet. So for families that have pets, what is the best way to manage those situations?
So the families with pets is increasing, the number of families with pets. What the understanding amongst the pet owners is, you do a rabies vaccination, anti-rabies vaccine to the pet, and that's the end of it. No. Like other living creatures, these pets are very much capable of spreading infections. They also need a good wash. They also poo and pee. You need to observe hygiene. You need to clean the surfaces they, move around in the house. Especially a child. Children are very fond of pets. So their paws, their body, it carries a lot of dirt and a lot of germs. So you need to, observe all these measures that we observe for ourselves and ensure that the pets are kept clean. Apart from, of course, anti-rabies protection that the pet and the child also needs. So again, wash them well, or wipe the surfaces that they touch. They sit on the bed, on the mattress, they sleep with the child. So you need to be extremely careful and ensure that proper hygiene is maintained.
Which brings us to that big realization that antibiotic resistance is not a hospital crisis.
No, not at all.
It is now a home crisis. It's in all of the surfaces that we touch, and the water we consume and everything else we're doing. It reinforces that one simple truth that washing your hands and actually cleaning your surfaces, sanitizing your flat surfaces will actually help us save a generation. So what's stopping us from making that our daily habit? Actually, that simple truth of hand washing, which can protect us from the need for antibiotics, is something that we can make a daily habit to protect us.
So as I said, curb antimicrobial resistance, it's in your hands.
It's in your hands. Savlon Swasth India Mission strongly endorses winning the AMR fight inside our homes, not just in hospitals. Doctor, let's zoom out for a moment right now and look at what's happening across India. It's not just inside the homes and schools, but also at a national level. Recent reports show that India now carries a high burden of antibiotic-resistant bloodstream infections in the world. And that instantly changes the timeline. This isn't something that's coming in the next decade, it's happening right now. And here is what has really stood out for me. India recently introduced a national action plan for AMR 2.0, a coordinated effort to strengthen labs, to track resistant bacteria better, to improve hygiene practices across our communities. Countries don't upgrade national response plans unless the situation really demands it. So antimicrobial resistance isn't just coming, it's here, which brings me to the question that many families never consider. Can a child's everyday routine, the food they eat, the cuts they get, the habits they follow, accidentally make this national problem worse? There's one more thing to talk about, which is self-medication. And we were discussing this a little earlier, that when it comes to self-medicating antibiotics, we're not just harming ourselves, we're also harming the community, which is different from any other kind of self-medication. Could you explain that to us?
Use an antibiotic, say for a fever. When I gulp a pill of antibiotic, it destroys the normal good bacteria that I have inside. The resistance, the tougher ones, in that colony, they survive. They are passed on through our excreta into the environment. And these resistant germs, as I said before, they pass on the information to other bacteria. The other bacteria also become resistant. The colony, the bacteria which are resistant, they proliferate, and then they pass on from one individual to the other. And that is how resistance, it starts from the community, unlike in the past, and it spreads. Yes. So, unlike say you have anti-diabetic or anti-fever medicine, you consume, if not required, it will harm only you. But if I consume an unwarranted, incomplete course of antibiotic, my resistant bacteria are passed on into the environment. The bacteria in the environment and around them become resistant. These resistant bacteria are passed on and they keep circulating. That leads to resistant infection. More bacteria, resistant bacteria, more antibiotics, more resistance. And the vicious cycle continues. How does one get infected? It's improper hygiene. The fecal-oral route is a very common route of transmission of many diseases. Typhoid, for that matter. The habit of washing hands after visiting the loo is not practiced. Uncovered, unclean food is consumed. And that is how the infections enters your body. And imagine if this resistant bacteria present in the contaminated food or water that we consume, you get infected with a resistant bacteria. Your routine antibiotics won't work. So self-medication is extremely harmful. Please do not use an antibiotic unless prescribed by a doctor. And when a doctor prescribes, use it in the prescribed manner. Complete the course, complete the duration of antibiotic, and take it in the frequency that the doctor has prescribed.
Has the medical fraternity now, made clear to all practicing doctors to reduce the prescription of antibiotics?
So rational practice is not using antibiotics. Use it when indicated. Yes. And when you use it appropriately. In the right antibiotic for the right illness, in the right dose, in the right frequency, for the right duration. So all this encompasses rational antibiotic practice, and this can happen only if a patient starts consuming antibiotic only against a prescription and follows the advice given by the doctor.
So basically, when we use, better hygiene at a community level and a family level, so hand washing, safe water, like you said, laundry disinfection, surface hygiene, wound care, because the bacteria gets resistant to medicines, but this is not to prevention. So if we do more prevention, we can actually save the community as well as keep our families safe. And that would be a great way to start. If you had to list out things that parents can do in their own families right now to reduce their children's exposure to germs, what would those be?
One is simple surface cleaning,
yes,
keeping the environment clean, age-old practices. Avoid self-medication. Use hand sanitizers wherever, as I said, wherever indicated and where required. Keep the wounds clean. Remain healthy by consuming clean, hygienic and nutritious food. That does not mean cost-wise a better food, but clean and hygienic food can be cheap and can be made at home as also. So if you follow these basic principles, and it's an age-old adage that prevention is always better than cure. So mind you, even today, bacteria are amenable to these simple measures. You prevent infection, there's no question of using an antibiotic. If you don't get infected, no antibiotic.
No antibiotic is necessary. So this is actually something that we should be doing to keep ourselves, our families, and our community safe. Savlon Swasth India Mission wants to emphasize the need to act towards antimicrobial resistance, not just when someone is sick, but also when someone is healthy as well. Now, when someone at home is already unwell, families often are unsure about the right steps. AMR prevention doesn't just stop during illness, it becomes more important. What should we do as parents when a child is sick? And we were discussing how sometimes parents will say, we have to travel or we have to go somewhere. So can you quickly prescribe something? Do you feel that doctors or pediatricians come under pressure from their parents?
I agree with you. That's not an uncommon problem. A parent would come and say, my child has bad throat. Doctor, can you please prescribe an antibiotic? This is what they would demand, that we have made a booking and we need to travel to a holiday destination. And unfortunately, sometimes under this parental pressure, doctors also succumb and they prescribe an antibiotic. So that practice should be discouraged. And I don't mind repeating n number of times that most of the fevers are viral infections and antibiotic is not required. Fever is not a sign of antibiotic deficiency in the body. That has to be driven home very clear.
When the child is sick, and obviously as a parent you panic saying, "Acha, 3 दिन से fever hai, the fever is not going. I should, you keep messaging the doctor again and again saying, no, the fever is not gone, the fever is not gone." What should we be telling ourselves? What should we be reading? What should we be doing to avoid the problem of self-medication? Because there's a temptation there to do anything you can to bring comfort to your child.
You should avoid and self-medicate. Self-medication is very harmful. Second practice is how does self-medication arise? One thing, my child has had fever in the past and doctor prescribed this antibiotic. I have something left over, let me try it again. That is one tendency. Secondly, my doctor had prescribed an antibiotic in the past for apparently similar looking like illness. So let me go across and buy the same antibiotic and try it again. So these two practices need to be controlled. They are harmful. And one should realize that fever is never an emergency. But of course, for a parent, a child having fever is an emergency. Then what can be done? Use simple measures. Try and control the temperature. That would reduce the child's discomfort. And you buy a time to reach out to a doctor and get an appropriate prescription. Let the doctor decide if he needs an antibiotic or no. And if doctor prescribes one, take it in its appropriate course. Don't allow any antibiotic to be left over for consumption in next similar illness.
When someone is unwell at home, obviously this person has either a virus or an infection of some sort. How do we care? And the caregiver, so the person who's looking after, whether it's a child or an adult, how do we make sure that that infection is contained? It's not passing around the house in terms of, the linen, the hand washing, all of that. What do we do?
So hand washing, use of hand sanitizer, surface disinfection, keeping the environment clean is important. Maintain a good temperature record. Ensure that the child has adequate fluids and good nutrition, and try and control the symptoms by using the emergency medicines that you have at the medicine box that you have in your house. And then try and reach out to a doctor. Beyond this, please do not self-medicate. Don't consume antibiotics. Today we are discussing antimicrobial resistance. So let me again re-emphasize that don't self-medicate when it comes to using an antibiotic.
Doc, you mentioned the box. All of us have a medicine box in our households in which we have all of our emergency medicines, but also at the bottom of that box winds up unused medicines from previous prescriptions. Tell us what should be in that box in order to keep ourselves safe and what should not be in the box at all.
So there is so much of inequity. There are houses where there is no medicine and there are houses where box is an understatement. They have a mini medical store at home. These boxes should ideally contain only emergency medicines which are not harmful, like say medicines to control fever, medicines to control vomiting in case the child or the patient vomits incessantly until you reach out to a doctor. It should contain hand sanitizer. It should contain disinfectant. So these things should be there, and a common first aid things which are required for cleaning the wound and bandaging it. Unfortunately, we find even antibiotics in the medicine box, especially the leftover ones. And you need to keep on checking the expiry of these medicines. Very often it so happens that you buy a medicine or the leftover medicines are kept in the box. And next time when there is a need to use, the medicine has passed its expiry date. So that is also important. So keep the box to minimum possible and don't have antibiotics in that medicine box. That's very, very important.
Would you recommend that anything left over from a prescription, which should not be left over at all, but let's assume it is, should be thrown out?
100%. First of all, you should buy what is prescribed and the course of antibiotic. And having purchased it, you should complete it. Half treatment is worse than no treatment. that propagates resistance.
All right. Doctor, thank you so much for answering all of those questions for our audience. There's a powerful irony here. At the heart of this entire conversation, antibiotics reshaped human history. They took us from an era where small infections were threatening lives to a world where a wound, a cut, a fever is no longer something to fear. But now the best way to protect antibiotics for the next generation is to make changes in our own daily habits. Daily habits that can prevent bacteria from becoming stronger than the medicines that we currently have. The change doesn't begin with complex medical protocol. It begins with everyday discipline inside our kitchens, classrooms, public spaces, and homes. The truth is simple. Washing hands isn't a small act. Cleaning wounds isn't a small act. Avoiding leftover strips of medication isn't a small act. Keeping our surfaces clean, eating fresh food, these tiny habits are everyday protectors. Invisible but incredibly powerful, because every clean hand delays the spread of resistant bacteria. Every avoided unnecessary antibiotic prevents mutation, and every completed course protects the next patient who genuinely needs the medicine to work. So before we close, here's a line I want everyone who's watching to sit on and think about. What if the small choices decide the future of our strongest medicines? Because this isn't personal anymore. As Doctor told us, it's community, it's global. Your choices are not just to protect you. They influence your family, your community, your city, and ultimately the strength of antibiotics for everyone who needs them. That's when we can protect the effectiveness of antibiotics. We give people easy memory keywords. Shake, S-H-A-K-E. So sanitize your surfaces, hand wash regularly, avoid self-medication, keep your wounds clean, and eat fresh and healthy food. So remember, shake off the infections before they begin. And now it's our turn to protect the antibiotics after the antibiotics have protected the human race for so long, because the future of healthcare doesn't just depend on advanced research. It depends on the smallest, simplest habits that we choose every day. Savlon Swasth India Mission is healthy habits for a strong India.